Hello and welcome back to your recovery video. I am Dr. Rich Castellano and we discussed the RICE acronym, rest, ice, compression, and elevation in the last video, and now we are going over my 4 F's of recovery: fluids, food, pharmacy, and phone. Okay, so the last 2 start with PH, but they sound like F, so I call them my 4 F's to make it easier to remember. So let's start with fluids. Keep it simple and drink enough fluids that you have to go to the restroom every couple of hours. It's a good idea to drink 2 or 3 liters, maybe 4 or 5 if you can tolerate it, of water per day. The main goal is to avoid dehydration. I do like to add electrolytes to my fluids. It helps me drink more, and I also like juices, Gatorade, Pedialyte, whatever works best for you as long as you are drinking fluids. The next F is food, and when it comes to food, there are no restrictions on what you can eat, though you may really not feel like doing heavy chewing for a few days. So soups, shakes, drinks, soft foods, little bites, they're great to start with, and then you can work your way up from there. Pharmacy. What medication should you be taking? This is what I tell my patients. Make sure you have a plan with your doctor that is specific to your needs and medical history. It's a good idea to be proactive with your pain medication and set your alarm to take the medicine at each interval your doctor recommends. I like to ask the pain score, 0 to 10. The number matters, and we like to get you to a 1, 2, or 3 pain score or lower as soon as possible. We use hydrocodone or tramadol, which are controlled substances monitored closely by the DEA, and we combine this with Celebrex, which is an NSAID or non-steroidal anti-inflammatory drug. It is okay to combine hydrocodone and Celebrex, also known as celecoxib, because Celebrex is non-narcotic and doesn't make you drowsy. If the wrap feels uncomfortable, make sure you're up on your pain medicine. The wrap tends to feel better when the pain is better controlled. It will feel better when the wrap is changed at your 24-hour post-op visit. Do not, I repeat, do not combine your pain medicine with relaxing medicine, sleeping medicine, or alcohol. It can really knock you out. It can be dangerous. Some may say, well, I really do want to be knocked out. The answer is, no, you don't. Combining relaxing medicine and pain medicine is dangerous and should be avoided at all costs. Please remember that the hydrocodone, it does have Tylenol in it, so you don't want to double up on the Tylenol. You can take either hydrocodone or Tylenol, but not both. We also recommend pre-treating with anti-nausea medicines such as Zofran or ondansetron or hydroxyzine 10 to 15 minutes before you take your pain medicine if your doctor prescribes this for you. Usually you will be taking an antibiotic as well, and if your doctor is prescribing other medications, just make sure you keep a chart of the medication you took, how many you took, at what time, so this way you don't take too many and you don't have to rely on your memory, which may not be so good while you're recovering. And if you experience itching, you can take the hydroxyzine, which is the anti-medicine. It's an antihistamine, anti-nausea, and anti-itch medicine. The last F for phone. When should you phone your doctor? If you have rash, redness or swelling in your body, arms or legs, definitely call your doctor to see if you're having a reaction to one of your medicines. You should call your doctor if your pain is not controlled, if you see drainage that doesn't stop, we don't expect that, if you're feeling unwell or if you're feeling chest pain or short of breath, that's very uncommon, but let your doctor know. And if you have questions about something that you don't feel comfortable with, give your doctor a call. Bottom line, we will get you through your recovery and you will enjoy your results. The body really has an amazing capacity to heal itself, and with this information, you can be more confident and in control as you let nature and the healing process take its course. In summary, the RICE formula, rest, ice, compression, elevation, the 4 F's, fluids, food, pharmacy, and phone. In our next video, I will discuss the day after or our 24-hour post-op visit so that you can be prepared for what's to come. In my office, we hold your hand each step of the way so that you feel comfortable, supported, and of course loved. And as always, if you have any questions, give us a call. I'm Dr. Rich Castellano. I'm really excited to be with you on this facelift journey. We'll see you soon.